Okay, good evening and welcome to the May 24th, 2022 meeting of the Needham Board of Health. I'm Rob Partridge, Chair. This open meeting of the Board of Health is being conducted in person and remotely per the Governor's Executive Order of 3/12/20 and is amended on 6/15/2021 due to the COVID-19 pandemic. The materials for this meeting have been circulated previously and are available on the town website. This meeting is being recorded. I will introduce each board member. Please respond by saying yes when your name is called. Kathleen Brown.
Yes.
Ed Cosgrove.
Yes.
Tejal Gandhi.
Yes.
Rob Partridge is here. And Steve Epstein will join us shortly. Okay, so to start off the meeting, the first item on the agenda is a review of the minutes from our emergency meeting on April 25th and our regular meeting on April 27th. So why don't we start with the 25th? Does anybody have any changes they'd like to make or other suggestions? Okay, motion to accept the April 25th minutes as written.
So moved.
Second.
Okay, all in favor by voice vote, Kathleen Brown,
Yes.
Ed Cosgrove,
Yes.
Tejal Gandhi,
Yes.
and Rob Partridge, yes. And moving on to April 7th. So I did have a question about the 27th. And it had to do with Sera Naturals. And I guess it's page 8 of your packet. It says that we would continue to disallow discounts beyond low income and elderly persons. I don't think we included elderly persons. I think that's what we're going to be discussing as part of the open hearing today. I think right now it's only low income.
You're correct.
So other than that, I didn't have any changes. Any others from anybody else?
No.
Okay, so a motion to accept the minutes from April 27th as amended now.
So
Second.
Okay, and by voice vote, all in favor, Kathleen Brown,
Yes.
Cosgrove,
yes.
Tejal Gandhi,
Yes.
and Rob Partridge is yes. Okay, now moving to the COVID-19 update and discussion.
I'll just take a moment. Thanks for joining us, Julie.
Sorry, I think I missed something joining as a panelist.
Well, I think we just said thank you for joining, and we're going to do the COVID update.
All right, perfect. I will jump in then. All right, so I guess first and foremost, you can see the percent positivity is quite high, not as high as it was when we were having the first Omicron wave. But I do want to keep in mind that this is 14-day percent positivity. So when we do start seeing a decrease in cases, it may take a bit to sort of reflect in this number because it's the 14-day percent positivity. I don't have the ability to calculate 7-day for Needham, but I did note today that the 7-day average for the state has started to take sort of a slow downward turn, and it's at 8.3% today, and the 7-day average for new cases for the state has also started to take a very slow downward turn, so it'll be good to keep an eye on that. Needham's percent positivity, I still include incidence rate, but I'm not sure that this is really a relevant metric to look at anymore. But the percent positivity is pretty comparable for the communities around Needham as well. Next slide. Our 7-day average of new cases is around 20. I'm not certain I would make anything of the sort of downward trend quite yet, because some of those recent numbers that I get are not quite accurate, waiting for data to come in from Maven. And again, this number does not include the at-home tests that are reported to us, but I'll talk about that in a couple of slides. Next slide. We had 454 cases in April, and the average age was around 36 years. We did have quite a few cases in the 40 to 49 age group, as well as the 0 to 4 year age group. And in May, there were 412 cases. Oh, sorry, next slide. In May, there were 412 cases up to May 19th. The average age was a little higher at around 38. Again, I would say we saw, the largest amount of cases in the 40 to 49-year-old age category, as well as the 0 to 4 and 5 to 9s. I do want to give some perspective for the April and May numbers to sort of bring it back to the last big wave of cases that we had at the end of last year and the beginning of this year. We had about 700 cases last December, and we had about 1,300 cases in January. So we're certainly, not quite where we were in that big wave. Next slide. I just wanted to mention the at-home test results that we've gotten. So people submit their positive at-home tests via a Google form to us, and we had 29 people report positive tests in April and 14 so far in May, up to the 19th. Most respondents said that they tested because they had COVID symptoms, and the most common symptom reported was a sore throat. I did want to note that, I don't include this information. I do want to talk about it because I think it's great people are putting the time and effort into reporting this to us. But I don't include this in our numbers in these presentations or in the dashboard because they're not confirmed cases. So these aren't included in the numbers from the state. They would be included in the numbers for the state if people sought out a PCR test to confirm it, or they got an antigen test with a healthcare provider, which would be counted as a probable case. But I do want to acknowledge that it's great that people are reporting their tests to us. It does give me some of this extra information, like symptom information, reason for testing. I ask about test brand. I get some age and demographic information. And most importantly, we're sharing with people the isolation and quarantine guidance after they fill it out. Next slide. So we're at 67% of our population has had a booster. We're getting very close to 95% or greater having 2 or more doses, so being fully vaccinated. For all age categories, I'm sure we'll get there soon with 5 to 11 years. And there was a booster dose approved for 5 to 11 years very recently, so I'm sure we'll start to see that number crop up here. We did have some increases in the numbers of individuals boosted, especially in the 75 plus year category, which had jumped, I think, from around 80 or 89% to 92%, which is good. A thing I do want to note is that there isn't any separation here for individuals 50 or older who have gotten a second booster dose. The state hasn't quite figured out a way to represent that data for us yet. Next slide. Again, the case numbers have just been increasing. I do want to note that I had previously been showing this for current reporting period, previous reporting period, and a year ago, but that sort of stopped being relevant with the prevalence of at-home testing versus PCR testing. So I now compare current, previous, and just to a month ago. And you can see there has definitely been an increase in all age categories compared to the last reporting period, and definitely compared to a month ago. But again, I'm sort of wondering what we'll see in the coming days or weeks as I started to see a slight decrease in the 7-day average of new cases for the state. The wastewater data had continued to increase every time I had checked on it in the South system and in the North system. South system is where Needham is included. As of today, or I think the data was posted yesterday, there actually has also been a slight dip in the wastewater levels in both the North system and the South system, most notably the South system. So we'll see if that continues. The last time there was a slight drop, it did pick right back up again, but I'm trying to feel hopeful. Next slide. The hospitalization rates, as usual, did lag behind the dramatic increase in cases, but have certainly increased from the last reporting period. And in this case, I still compare to a year ago. And I think it's interesting to note that compared to a year ago, the hospitalization rates are higher in all age categories, fairly significantly, but most notably in the 70 to 79 and 80 plus category, the hospitalization rates had been quite low this time a year ago as the weather warmed up, I would suspect. But again, I would take the hospitalization rates, knowing the information from this slide, in that only a portion of the total COVID hospitalizations are actually due primarily to COVID. And the total number of COVID hospitalization has increased, which makes sense because the circulating virus has increased. And so there are going to be more people admitted who test positive for COVID. But the percent of those hospitalizations that are primarily due to COVID has remained at about 30% very consistently for the past few months, and that hasn't increased.
Julie, do we have data going back a little bit farther, because the scales are very different on those last two graphs?
Yes, we don't have data going back further on that last graph. But that's when the state started recording this.
Okay, are we assuming that cases prior to that were due primarily to COVID? Because if we are, we can then, go back and take a look at what was going on in 2020 and 2021, since those probably were primarily due to COVID, and plug that in as a comparison.
Yes, I can put in I can definitely graph the total number of hospitalizations. Yeah, if we want to make the assumption that it was primarily due to COVID, though I do think, for a while before the data started being collected, it was suspected that the percent primarily due to COVID was lower than people had been expecting. But I guess this sort of lines up with, when is this, January 2022? Yeah, I guess, starting at the beginning of the Omicron wave is when we could, I think, start to assume that, that there was a significant difference between the total number of hospitalizations and then those primarily due to COVID.
Right, so what I'm looking for here is the Delta wave. Because the Delta wave, we think, was primarily COVID, because if we really are seeing an increase in hospitalizations primarily due to COVID, that's a warning sign that we need to pay attention to.
Yes, absolutely. Yeah, so I can, when I'm showing this in the future, I can go back and just, keep that top one of total number of hospitalizations.
Great, thanks, Julie. Rob and Kathleen were on the Joint Health and Safety Committee call yesterday, as was I. The schools are having quite substantial volume of cases. The junior boat cruise that, as of yesterday, had 38 cases attached to it that had occurred on Friday. They're concerned about sort of the volume of cases. The superintendent did send out a fairly comprehensive message to staff and to families, reminding them about some key sort of messages, including staying home when you're sick, testing, availability of tests, recommending masking, although making clear that Needham is still a mask friendly, so there's a choice that people have. But that's something that the board should be aware of, is that the schools are very busy with COVID cases right now. That does coincide with the state continuing to curtail or scale back its testing program, So it's in school testing program. As the funding wears down, they're having trouble filling positions based at the schools. So that's a thing to be aware of, I guess.
Yeah, my question, for us, and I don't know if we can do this with the schools as well, is at what point do we say we need to go back to mandatory indoor masking? I mean, the kids aren't going to get sick. Or horribly sick. I'm not worried about keeping them out in school, but can we prevent some spread with masking in schools? Is that worth doing? Particularly since we're seeing hospitalizations due primarily to COVID.
I think that's an interesting question. I think, our data, and I'm not necessarily including the recent period, but our data anecdotally from the last few months has been somewhat extracurricular driven. So, we're talking about 38 cases coming from a junior boat cruise, the one or two other smaller cases with events or meetings.
Right, but those kids got it someplace, right?
Sure. Yep.
They spread it because they were in close proximity. They happened to be in a boat cruise, sure, but they were also in school too.
Yeah. Yes,
I think it might be a little hard to say exactly where that outbreak happened, right?
absolutely.
Because they're all together in the classroom and they're all together in the boat cruise.
Yep. I do think and Kathleen and Rob, feel free to jump in, what the Director of School Health Services has found in sort of surveying her school nurse leader colleagues is that when there is a strong recommendation for masking, the people who mask sometimes and don't mask other times convert to masking almost all the time. The people that are not masking don't mask in their experience. A number of schools are sort of at that point of, do they strongly recommend masking? Do they require masking? Do they just trying to highlight, you want to make sure graduation and prom happen, so you have to be cautious and make good decisions. Again, it was a spectrum of answers there.
Yeah, I mean, that's an interesting point, right? If the threat is, some of the extracurricular activities would be curtailed. Now that you've had a super spreader event and an extracurricular activity, are the schools making any preparations to curtail these types of events now that they've actually had a super spreader event and an extracurricular activity?
So we did, at a meeting before the Joint Health and Safety, we did review the bus protocol, which hadn't been necessarily adhered to for the junior boat cruise event, which is that at least every other window has to be open on the bus. So one of the concerns was that that wasn't necessarily followed in full.
Yeah, but to say that this all happened on the bus and it didn't happen on the cruise, everybody was on the same bus too. One bus?
No, multiple buses, yes.
Right, so it probably didn't happen on one bus. I just don't want to see the response being, oh, it was the buses, that was the issue. So we'll increase the bus protocol, but no, we're still going to have all these extracurricular events where we're going to put all these kids together and they're all going to get COVID together.
I think
That
the
doesn't
thought
make a lot
was
of
that if
sense.
there's better ventilation on buses, that's a modest mitigating factor, but it doesn't change the entire trajectory.
It seems like at large indoor events, of which now the cruise thing, I'm guessing some of it was outdoors, but I'm guessing a lot of time they were indoors. But it seems like, particularly for these schools, if they have a large indoor gathering, whether it's a school concert at the end of the year or whatever it is, it's way more people than usually are, getting together in a setting. That seems like an opportunity to say, we're going to require masking at large indoor events. To your point about super spreader.
And there are a lot of those events. There's the senior cruise coming up, there's prom, there's graduation, but there's also, we learned like at Newman for the first time, I think it was Newman, they had 400 kids for the first time in a big auditorium for a special event.
School plays are happening.
Yes, yeah, so.
There's a lot of things happening with large groups in auditoriums.
I think this would be a very unique case. I mean, the colleges are not masking in events. I think other schools are not choosing to do this. I also don't think that the school masking studies are there. Do we see that it makes a difference? And we also seem to be on the downward swing of this this peak. So I think it would be out of step with other communities for sure.
I hear that Brookline just instituted mask mandate in school.
In public buildings.
How is it? I mean, I'm looking at this data and it looks like we're on the upward swing in every category. Upward in hospitalizations, upward in infections. We're upward in the wastewater.
No, wastewater's down. That's sort of the point this week, I think.
This week, right, 1 week. I mean, I'd like to see it go down consistently, obviously. But, you know, if you look at the trends here, it's unequivocal, this is going up. But most importantly, you have the hospitalizations going up. I mean, that's the thing that I think we can pay attention to, because you're right. I mean,
I guess, I mean,
about
there's what, 277 in Massachusetts? Is that the number that we saw? And it's been pretty flat for the last few months, maybe 220 earlier for COVID.
No, I think actually it was put down to about 50. Looking at this graph, I don't have the exact numbers, Julie, maybe you have those, but that's pretty low.
This 277.
Yeah.
277 as of now, but if you're wondering how, you know, what was it, a month and a half ago? Just eyeballing that, it looks like it was probably about 50 to 100. So we've more than doubled.
And I think, to be clear, I was saying that for large gatherings, I think it's something to consider. I'm not necessarily saying for in the classroom, though Brookline did go for that in the classroom. But if you think about sort of a middle ground, of saying we're not going to do, the superintendent sent the thing out, I got it, which said, we strongly recommend. I think to your point, people who are kind of on the fence, which I told my kids, okay, no choice now, you have to do it, but I'm pretty strict on this, but other people are going to say no. But that message did go out, but I do worry about, big auditoriums with 400 people in.
So the schools still are operating their ventilation, running their ventilation system to red line. So they're still taking in virtually 100% fresh air intake, no recirculation of air. And that's still the case in all spaces. So they're shooting for the ASHRAE standard for air changeovers per hour, and meeting or exceeding that in all spaces, which obviously ventilation is a key part of controlling COVID, but in large gatherings is also a key part.
Or at least mandatory masking with large gatherings. We're not even saying necessarily limiting large gatherings. I mean, there are a lot of important events for the kids, but you can have them, let's consider mandatory masking at those large events.
I do want to be sensitive, Mr. Chair, to our timing. We had projected to have a very brief discussion about the entheogenic substances before we open the public hearing. We do have the option to push back some things with the exception of the hearing. That's one thing we have to make sure starts on time. Or sorry, reopens on time. So we have about 5 more minutes till the hearing would reopen.
Okay, are there other things that people would like to discuss related to COVID-19 before we move on from that?
Only just where do we go from here? I mean, we've had some discussion, but where does this go?
I think we should wait and see what happens in the next week or so. If we have to have an emergency meeting.
And so let's say we get data for 2 more weeks and then reconvene. Look at the data.
If we have to,
Yeah, I
We
mean,
gotta
that's
look
it.
at the data, right? I mean, we might not have to have a meeting at the data. It's all
Exactly.
good. Yeah, but if it's not looking good, then
It is a little bit tricky now because the end of school is pretty close. There's a lot of events. My sense from the meeting yesterday is the superintendent doesn't want to just cancel all these events. And the idea was with the message that, they would make people aware that cases are on the rise and, these are not zero risk and there may be more risk by going to the events. And that people should take this data and make their own decisions about, whether they're going to have their kids mask or go or not.
there's a lot of peer pressure amongst kids.
Oh, I
And I
know.
think that needs to be taken into account. So, no matter what
Sure.
the parents are saying and the kids, maybe feeling like, they're being pressured not to mask
Mhm.
when maybe they really want to.
Yeah.
Making, that's a really, that's a good case for saying, if everybody's masking, then that's it, There's no choice in the matter. Everybody does, everybody goes and has a good time.
If the primary goal is not to have to cancel events, which I think should be the primary goal, then it seems to me that mitigation factor of, wearing masks is probably the most effective way to not have to cancel events. Because, if you have another big super spreader, then canceling events is going to start being more on the table, I think. So, if that's the goal, not to cancel events, then it seems like being tougher on masking is probably the optimal way to do that.
I think the other thing that's becoming an increasing concern is that since symptoms are pretty minor, if you have symptoms, people might not notice that you have symptoms, and people are going to
allergies.
choose not to test. They're going to blame their symptoms on allergies, and they're going to go to school. They're going to go to these events without saying anything, so they don't have to test, which is a very difficult thing to do. Okay, but I definitely agree. It makes sense to look at more data. But as that starts to come in, we're going to be past a lot of these events and much closer to the end of the school.
I think we could, at this point, maybe go for the middle ground and strongly recommend masking without requiring it. But if the numbers continue to rise, then we would require it.
Makes sense.
Tim, the message from Dan Vidikins talked about masking, recommending masking in schools. I don't know if he mentioned kind of these bigger events like, the school concert or the play or that kind of stuff. So I don't know if that was in that message. I can look at it again.
Yeah, I don't have it in front of me, but we could certainly look at that.
Okay, so 6:30 now. So why don't we have a continuation of the hearing,
So you would reopen the hearing.
and then we'll do antigenics after that.
on April 27th. Yep.
Yeah, we can do that.
Okay.
We need a motion to just change the agenda or just.
No, it's okay.
Okay.
All right, do we need a motion to reopen the hearing, or?
No, you as chair can officially reopen.
All right, so it's 6:30 now. I will now reopen the hearing that we started at our last meeting and continue to this meeting. Proposed revisions to Article 20, regulation to ensure the sanitary and safe operations of marijuana treatment centers.
Yes, so this was posted for public comment, the Board of Health red line version, which is included in the packet. The only comment that was received was a letter from Sierra Naturals from Mr. Smart, Sierra Naturals. No other comments from the public were received, no other phone calls or letters. There certainly are obviously two gentlemen in the room who may want to speak on this subject, and there are people who are attendees that I recognize are not being staff members, so they may or may not be interested in speaking on this subject as well, Mr. Chair.
Okay, so we have allotted 30 minutes. And I guess, why don't we hear initially from the people that are in the room? And do you have a sense of how many people are
Based
on
on
remotely that?
only on last name, or
Four, okay. All right, so I think that we would have time for at least 5 minutes for everybody.
Yeah.
Okay, so I think we've all reviewed the materials and the letter from the attorney and the changes that were suggested by Sarah's attorney. So I guess three people here. We've met you, Robert, last week or last month.
That's right.
Okay.
I'm a local attorney. I was a member of the planning board for 10 years and also a long time meeting member.
Mr. Chair, Bob, for you, generally with hearings, we like to have the person introduce themselves as Mr. Smart is doing, and then also give their either affiliation or their address if they're a Needham resident.
Okay. Well, my home is 25 Mayo Avenue. Been there since 1980.
Okay, thank you.
Yeah,
Would you like to start?
Yeah, if I may. I
Absolutely.
do have an original, by the way. Right. So, Sura Naturals, Inc., which operates a medical marijuana facility on Franklin Street, asked me to help with their effort to persuade you to make some modest changes to your medical marijuana regulations. I know that's been under consideration for some time. Thank you for allowing us to participate. I'm here with Lou Carter here, who is a long-term Eden resident, one of the founders of SIRA, and he's an officer and director of SIRA. We have John Fernandez right here, who is SIRA's regulatory counsel. He's from Milford.
Originally from
Originally from Milford.
40 years, 50 years, 60. Oh, let's go for almost 70 years.
Yeah, don't date yourself.
I tried to get him to meet him.
So also attending via Zoom is Juan Patnack, who is SIRA's Vice President of Governmental Regulations and Community Investment. She'll speak with your permission after I do. And Gretchen McCarthy, who's the Vice President of Retail for SIRA, who's basically on in case there are questions about the operations. 20th, I provided a letter and proposed red line version of Article 20 to the board. We accepted all of the board's red lines, which seemed appropriate to us to create a clean document. And after that, redlined our proposed changes. We thought it'd make it the easiest way for you to see exactly what we're looking for. The proposed revisions pertain primarily to discounting. To section 20.3, we propose to add definitions for veterans, seniors, HIV/AIDS patients, and cancer patients. To section 20.3, we suggest two technical corrections to the definition of MTC permit to eliminate the references to nonprofit entities and to the Department of Public Health. And this would comport with the changes that the board, I think, has already had recommended to it in its definition of marijuana treatment center. To section 20.6.5D, we propose to add veterans, seniors, employees of a marijuana treatment center, HIV/AIDS patients, and cancer patients to the categories of persons to whom discounts could be offered. I'd like to highlight just a few points. First, state laws and regulations pertaining to marijuana facilities have changed since Article 20 was adopted. The Department of Public Health regulations in force at the time for medical marijuana prohibited discounting, except for required programs for patients with verified financial hardship. The Cannabis Control Commission's regulations make a distinction. Discounting is prohibited for recreational facilities, but it is not prohibited for medical facilities. Second, the board's broad prohibition on discounting puts SIRA in a very unfavorable position. Other medical marijuana facilities in the area advertise discounts to all patients routinely, and as they are not subject to local regulations prohibiting discounting. Third, medical marijuana patients are not like pharmacy patients. Well, most pharmacy patients have insurance, which cover at least some of the costs and have varying levels of copays. Patients at medical marijuana facilities pay 100% of the cost out of pocket. The discounts for patients with verified financial hardship are only available to a small portion of the patients that come to SIRA. Most of the patients we seek to help would benefit from the help that discounting would provide. Fifth, allowing discounts for veterans, seniors, HIV/AIDS, and cancer patients will help these vulnerable patients and reduce their incentive to acquire their medications on the black market. Sixth, allowing discounts to employees will help SIRA to attract and retain employees, as competing medical marijuana facilities are allowed to offer this as a benefit. We believe that this modest discounting authority that CIRA is seeking is consistent with both the state's regulatory approach and in the interest of public health. So thank you for your consideration. At this point, I'd like to, with your permission, turn it over to Juan, who is on Zoom.
Promoter to panelists. One is here.
Hello, can you hear me?
We can.
Yes.
Thank you. Thank you so much, Attorney Smart. Good evening. My name is Dewan Packnett. I am the Vice President of Government Relations and Community Investment for Sierra Naturals. To the board, thank you for this opportunity to propose revision to your red line version of the Board of Health regulations. We are requesting the board's consideration of a modest change to section 20.6.5D. Specifically, in addition to the financial hardship discounts you have permitted, thank you, we are requesting the opportunity to offer limited discounts on cannabis products for the following medically and financially vulnerable patients: veterans and senior citizens, HIV, AIDS, and cancer patients. We would also like to provide limited discounts for our employees. The changes we are seeking for the people in these categories will have a significant and meaningful impact on their lives. We believe the discounts we are proposing will ensure a safe, accessible, and convenient alternative medical option is available in Needham for those undergoing life-saving medical protocols, chemotherapy, radiation, AIDS treatments, or chronic conditions often associated with aging, arthritis, menopause, early onset dementia, and Alzheimer's disease. Providing discounts for these medically and financially vulnerable patients will ensure that Sierra's 3 medical treatment centers in Somerville, Watertown, and Needham are operated with equity, equality, and program uniformity. Founded in 2013, Sierra Naturals is one of Massachusetts' first seed-to-sale, vertically integrated medical cannabis companies. Our company has grown into one of the Commonwealth's largest cannabis employers. Our locations include Milford, Boston, Somerville, Watertown, and Needham. Community is the most important aspect of our business. It defines who we are as a company. So let me speak briefly about our facility at 29 Franklin Street and our commitment to the town of Needham. Our location has smart and dedicated employees. And as Tim McDonald stated at our September 2021 hearing, we have had no incidents since we opened 4 years ago. Most important, diversion is at the front of our mind for compliance and operations. Our protocols are second to none. For instance, we inventory nightly while the industry standard asks for weekly inventories. We are most appreciative of how the town has collaborated with us to make this location successful. Notably, our commitment to the town of Needham is that we have just renewed our lease at the 29 Franklin site. And now, with the relaxing of COVID protocols, we are dedicated to reconnecting with members of the Needham community through the Courageous Conversation series, and we look forward to participating in the excellent work of the Needham United Against Racism Initiative, NUARI, and the Needham Diversity Initiative. We take our partnership with Needham very seriously. We believe our recommended changes will assist us in serving medically and financially vulnerable populations in Needham. So let me offer the following rationale for each of the discrete categories of patients for whom we propose limited discounts. Employees. Acquiring talent to maintain a successful cannabis retail operation is extremely competitive now and will continue to be as Massachusetts market expands. Sierra was the first employer to voluntarily unionize as a demonstration of our commitment to competitive wages and benefits for our employees. However, even with our experience, excellent reputation, and despite voluntary unionization, we are at a competitive disadvantage with respect to hiring and retention. Sierra is requesting the opportunity to offer employee discounts to ensure that our medical treatment centers in Somerville, Watertown, and Needham operate with equity and program uniformity. We offer employee discounts to all employees with a medical card as a recruiting tool with the expectation that the employee can take advantage of their employee discount from wherever they choose to live. Presently, The only way that our employees can take advantage of Sierra's company-wide employee discount is by traveling to our Somerville store. On a good day from Needham, this can be a 45-minute trip by car. And while that may not seem to be a lot, having to travel 45 minutes to take advantage of something you earned in Needham when that same item is being sold in your store in Needham is a frustrating experience. The next category for discounts is veterans and seniors. In October 2021, the Cannabis Control Commissioners, Bruce Stebbins and Kimberly Roy, published the following in an editorial opinion on Mass Live, emphasizing the importance of veterans to the Massachusetts cannabis industry. And I quote, "The servicemen and women who have kept our country safe, then returned home to Massachusetts, deserve opportunities to thrive in new careers that support their families and receive the care they need. The regulated cannabis industry was designed to offer them that network of support, and we encourage our peers in government, industry, and the public to continue prioritizing veterans' success," end quote. Sierra Naturals would like the opportunity to offer limited discounts to veterans and to senior citizens age 65 and older. These two groups of residents are often recognized for their contribution to our community and nation through the receipt of enhanced benefits and discounts on things like property taxes, transportation, food products, and movies. Our intention is to help these seniors and veterans who have given so much to us over their lives by providing the proposed modest discounts. We recognize that patients, often seniors and veterans, seeking treatment through our facility may suffer unnecessarily from intermittent access to their medication due to uncertain finances, but who may not qualify under the financial hardship discount. We believe that even a modest discount can smooth out the jagged edges of treatment interruptions for these patients and offer consistent and reliable access to important medical relief. HIV and cancer patients are the final group that we're seeking discounts for. We would also appreciate the opportunity to offer a critically important discount to these patients with a cancer diagnosis or who have HIV/AIDS. There is an unquestionable benefit to these customers as part of their treatment regimen, especially for those treating the consequences of their diagnosis or any side effects that may be occurring during their prescribed pharmaceutical medication. Just like any retail location, these patients expect an opportunity to take advantage of discounts similar to those discounts already provided in other medical marijuana facilities. Sierra Naturals believes strongly in our mission to provide access to the safe therapeutic solutions through medical marijuana and by offering even modest discounts to those with cancer or HIV/AIDS diagnosis, so we can ensure that access to their treatments is less financially onerous and more convenient. This is an unquestionable benefit to the use of medical marijuana for cancer patients as part of their treatment regimen, especially for those treating the emotional and mental health consequences of the diagnosis or any physical side effects that may occur due to their pharmaceutical medication. We seek to remain competitive with all other in Massachusetts who offer discounts while being sensitive to your concerns. So we have, with intention, limited our request to a modest but impactful group of folks: veterans, senior citizens, HIV/AIDS, and cancer patients, and of course, Sierra employees. Dispensaries are no longer unique in Massachusetts. We are a retailer that competes with other retailers. And with the new ones being offered with new licenses being offered and approved by the CCC each month. The industry has matured, and we are seeing the consequences of being unable to provide discounts for our Needham patients. They simply drive by 29 Franklin Street on their way to other facilities in other neighborhoods who do offer discounts. At previous meetings, this board has made the comparison that our medical facility is akin to a pharmacy. We believe there is a distinction. Patients that go into a pharmacy have the benefit of both of their health insurance and or access to drug manufacturers' rebate coupons for brand drugs. Insurance offers a significant reduction in the actual drug pricing for a wide population. but especially for those seniors, veterans, and medically vulnerable patients that are the focus of our concern this evening. As a cannabis operation, our customers must pay 100% of the cost of the medical treatment at our medical dispensary. While the treatments our patients seek with medical marijuana are proven to be beneficial to their health outcomes, we do not have the ability to limit their out-of-pocket costs to co-pays as consumers are able to do at pharmacies through the use of insurance. That is why Sierra Naturals is looking to offer these discounts to a limited number of vulnerable patients in our Needham location, the highest percentage of whom are Needham residents. Our patients are not only medically vulnerable, but rely on cannabis treatments to ease their chronic illnesses. With the ongoing stigma attached to cannabis prior to its legalization, we want to remove cost barriers that prevent these patients from pursuing their regular treatment regimen. The limited discounts we are requesting will ensure patients have access to safe, regulated cannabis products as responsible alternatives to the illegal or underground market, which from all indications continues to thrive. Thank you so much for your time, and our team looks forward to answering any questions that you have.
Thank you.
That's the end of our formal presentation. We're happy to discuss, answer questions, whatever the board prefers.
Mr. Chair, the board is certainly free to engage with questions and back and forth. You could also see if anyone else online, there's at least 2 names I don't recognize as staff members, might either just be listening, but might also want to ask a question.
I mean, since it's a public hearing, I think anybody who is present who would like to speak, I think should be offered that opportunity.
Sure, if they could raise their hand digitally, I will promote them to a panelist. They'd have an opportunity to ask the board to testify before the board. So we're looking at Jefferson Smith and Kristen Heffernan.
Jefferson is with us.
Jefferson is, okay.
Okay.
Okay, so then there's nobody else.
Okay. All right, so discussion.
I have a question. Can you describe or define limited discount and what that actually, much of a discount are you talking about when you say limited discounts?
My understanding is that what the company is interested in is somewhere in the 10 to 20% range for, Ron, correct me if I'm wrong, I'm not as close to this as some others here that are on this call. But I thought it was for, at least for seniors and veterans, it was in the vicinity of 10 to 20%. I think it's higher for employees because that's what's going on in the industry. We are talking about a limited number of people in terms of employees.
Yeah, and so on the employee side of it, it's a 50% discount. And it's also a means for the cultivation facility, the employees in Milford, to come get product and bring it back to Milford as far as testing and all that. As far as the Dwan or Gretchen, if you can hear me, the CCC requirement for veterans and seniors for discounting. You have the exact percent?
There is no regulation around the percentage, but I can speak to the Somerville location. We do offer 20% for our veterans under that program.
Thank you.
20%. What would the veteran pay?
20% of the retail medical price. So say something is $20, it's $16 for the veteran or some.
What's the current going price? Let's put it that way.
Essentially, yeah.
Because I'm not seeing anything in the
Right.
CMR. About discounts at all.
There's a specific prohibition in the CCC regulations on discounting for recreational marijuana.
There's zero discount.
That right, the prohibition So the regulations are sort of parallel. There are prohibited practices provisions in both sets of regulations. Discounting is prohibited in the recreational area. In the medical area, it is simply not addressed.
Well, it is addressed to the point that the financial discounting program is
Hardship.
Financial
the
exemption.
hardship.
Yes.
Yes, that
Yes.
is required, and it
Yes.
is, again, in interpreting regulatory and statutory provisions, they knew what they were doing when they put the prohibition. These regulations were issued at the same time, and they knew what they were doing when the rewrites of them. Obviously, the medical regulations were done first and recreational, but when these were both rewritten, they did them at the same time, and they specifically prohibited in the adult regulation, recreational side, and they did not prohibit on the medical side, providing for discount, leaving open, and they are certainly aware that the vast majority of medical facilities are discounted for the kinds of things we're talking.
Currently, it's 20% for hardship.
Yeah, so 20% for hardship, senior citizens, veterans, so forth. So the ask is to follow 20%.
And you had a question before that.
But if I came in with a prescription, how much am I gonna buy? I know nothing about it.
So-
I need to do it.
No,
If I come in with a prescription, do I buy it by the ounce, the gram?
it depends what you're buying. It could be the ounce, the gram, it could be
Okay, say an
a
ounce.
single thing of candy that say goes for $30. So it'd be 20% up, so
$24.
$24.
Yeah,
Yeah.
it certainly does vary, but our average ticket is about $120.
That's your average sale.
Is the percentage
Yeah.
discount anticipated to go any higher for any of the groups that we've talked about?
No.
Only because the higher they go, I would be concerned that might be more potential for abuse of the system. If it were 50%, then everybody would do.
Yeah, the 50% is just enough employees and there's how many, maybe a few dozen employees there. Just looking to follow with our peers and other medical schools. So it's the hardship, but no intentions of going above that.
And I will tell you, we asked the question of our retail managers as to whether, we don't have this statistic, but anecdotally, whether they're seeing a buy by people. In other words, taking the discount and applying it to an increased purchase, and the answer is no. That their view of what happens is people are content to take that discount pocket, go away, particularly in these economic times, and particularly people looking to take advantage of the discount. Now, understand, in many stores, the discount is not controlled by the categories we're talking about. They're available to the general public. We're asking to limit it to the categories.
I'm curious, why employees? Why not just pay your employees more
We're-
rather than offer a discount to them? I mean, if you're attracting employees, I mean, that would seem to be a natural way to do that.
I think what people have found is that there are employees who have medical cards, and it's grown up as an incentive in the business that employees can have the discount as it's been described to you. And they will look for the opportunity to have that. I mean, these folks offer a very competitive wage. As you heard, they're the first company in Massachusetts to unionize, and they did it voluntarily. They stepped forward, brought in the negotiators and said, we want to unionize our staff, in the hopes of offering the kind of benefits that will incentivize them. But I did a lot of labor negotiation in my life. People get into these silos of benefits that they're used to, and it doesn't necessarily offset 5 weeks of vacation to offer more pay. It's a benefit they expect to find in the business, and that makes a difference to them.
Thank you. Actually, just you answered the question inadvertently. So it seems like the employees would have to also have a medical card.
Oh, absolutely.
No one can go in the store.
Everyone.
Their employees obviously are in the store, and some of them don't have medical cards, right?
They
They
can't.
get them upon hire. She said they get them upon hire, correct?
I'm sorry.
Your employees get them upon hire is what we heard.
No, you could be an employee, but you can't need them is medicinal only.
Correct.
So it doesn't matter if you work there or you don't work there.
So they have to
You would
go
have,
there.
you would have to go through a doctor to get a medical card to qualify.
They has to have a card.
Do you have a sense of, if you take these groups, the veterans, seniors, HIV, cancer, if you take those, what percent of your total population is that comprising?
For this particular store, Gretchen, correct me if I'm wrong, but we're probably speaking 20% of some of the store.
Yeah, it's really hard to tell because we haven't offered the discount, but in other like stores like Somerville, it is, you know, between 15 and 20%, if that. It's a very small population, but we do see that they, you know, benefit from the discount and they're very grateful. It's not a large population, but a small percentage. And we obviously don't know because we haven't offered it in Needham. It could be much lower. We just have a very, you know, robust operation in Somerville that the percentage could be, you know, higher just due to the amount of patients that we have. We have much less in Needham, so I anticipate that percentage being a little bit lower, but definitely a smaller percentage.
As to the HIV and cancer patients, why should we create a special class for those patients as opposed to any other medical patient?
I think Juan can explain that there is a significant program being run out of the Boston region called Frank's
Yes.
Place.
So
This is-
we,
One of the
I'm
things
sorry.
that companies is to offer a benefit through cannabis companies to reduce, but Juan, go ahead and explain.
So we have, there's already AIDS patients group that exists. The name of it's Frank's Friends. And what Frank did was to go around and to cannabis companies like Syrah and look for discounts for AIDS patients. There are not that many people that are included in Frank's Friends, but that's an existing program that's only available in Somerville. It's not available in Needham. So for example, if someone is out traveling and they see a Syrah Natural store and they would think that the Frank's Friends program would be available in Needham as well as Somerville, and it is not. You'd have to go to the Somerville store to get the discounts. One of the things we looked at, and a lot of it may have to do with the fact that I am a former cancer patient as well, is that for people who have a diagnosis and are coming in for specific medicine to take care of the effects of chemotherapy or for treatments, we didn't see why limit it that we only did AIDS patients. So that's why we added cancer patients as well, to be quite frank.
But why not add other classes? I mean, you're asking us to create a special class of patient. So we are by nature, if we do that, being discriminatory for some medical conditions as opposed to other medical conditions. So I'm looking for a rationale here other than like including cancer patients just because we should, you know, or HIV patients just because there happens to be a discount, you know, someplace. Because they're going to, group that comes to us that has a different medical condition for which they are being treated are going to say, why are you discriminating against us? And we have to be able to address that.
If I could,
Go ahead.
if I could respond. So one of the things I think with cancer patients in particular, and I think with chemotherapy, it is fairly well known that cannabis is one of the ways to help you get through chemotherapy. And one of the things as someone who has had cancer and who had to set up and have times of when I was going to have my cancer treatments, when I was going to do chemo so I could go to work, because I had to be to work on Monday. So you schedule, it is a very particular illness where you need the convenience of being able to get medicine. You need to be able to sit and have your chemo treatments and be able to be sick, for example, and to get better so you can continue to flourish, if you will, or you can get past the cancer treatments. I think cancer is a little different because you have the diagnosis, because you have the schedule of chemo treatments. In my case, it was 6 every 3 weeks, and that you're doing this on a certain day. And so there's a certain preparation and convenience that is needed for how you're going to get through that. There may be other illnesses that would also fit. It is not as though as we're not interested in that, but the AIDS, because we have an AIDS program, because we're well aware of the cancer, of the effects of cancer and the cancer diagnosis and the regular treatments that you're going to have to go through. We included those too. There in no way are we limiting or discriminating against anyone else or adding other illnesses if in fact folks come forward and say that we find ourselves in the same situation. And I say this because of financial impact that we mentioned earlier, that having to prepare a lot of the things, even if you have insurance, which I did, and even if you are ready and ready for cancer, the fact that I was self-employed at the time and could not take time off of work and had to be prepared to go to work made me have to have anything that I could get to make that situation easier. I would say that to allow folks the option of doing what they can do to ease the effects of chemotherapy or from AIDS treatments is our goal, but it's not in any way are we trying to limit this only to those two illnesses. In fact, this is part of our effort to keep things narrow within what would be acceptable, frankly, to this board. But we'd be more than interested if there are other illnesses that we could include. I would say that without talking to Lou, but.
Honest, and that's what we're trying to be here, is transparent about all of this. Generally, we would offer discounts to the entire population of people who come in with medical. We understand that this board has expressed, concerns about the use of cannabis, about the diversion of cannabis, about the access to cannabis. And what we are trying to ID here is the realization that, one, we have an existing program at our facility and other cannabis programs, other facilities that are addressing AIDS and HIV. So we want to be consistent in offering that here. And we think that, Dwan has I think, courageously discussed her own situation here. I have a young family member who went through cancer treatment a year ago. And the use of marijuana is very helpful.
I did have a question about definition of a cancer patient. And, I think we've been talking mainly about people that are being actively treated for cancer, but the definition says a person with a cancer diagnosis. Are we talking about an active under treatment diagnosis? Or are we talking like, you had squamous cell cancer, which was removed 12 years ago?
We're speaking active.
Yeah, we're talking somebody who's.
That's what we're talking about, but that's
I think
quite
we're
what it
thinking
says on
about a
the.
patient who's actively under treatment or monitoring a few year period of time since the diagnosis. There's a medical certification that comes along. I apologize. I've been doing this stuff a long time. I don't usually get emotional. We are not talking about protected classes. So, just as in the pharmacies, you might be able to get a manufacturer's rebate for one drug that you can't get for another, treats a particular thing. This is not meant to be, a legal protected class kind of an issue to you.
No, I know you weren't thinking
thinking
that.
that way.
Taking this to the,
Yeah.
I'm just actually taking it to the logical.
And I appreciate
If you
that.
include everybody,
Right.
and everybody's getting a discount.
Right.
You're just basically lowering your price to everybody, right? And then there's no discount program really necessary because the price is the same for everybody.
In this case, you gotta understand, we're a medical only store in Needham. We have no intentions of coming back to and asking to become recreation. We are a medical store, staying in medical store, start to finish. It is what it is. And being a medical store and people have medical cards doesn't necessarily mean everyone has gone through cancer, is currently going through cancer, surface and HIV, whatever. I think it's trying to keep up with what we do at the other stores, what the market is doing, and most of the other stores are recreation and code, and recreation and medicinal only, when we are just medicinal.
Mr. Chair, if I could, just to clarify, so Sierra has 3 medical licenses and 3 recreational. And I believe right now you're using the full sort of allotment that's provided by the Cannabis Control Commission. Is that correct?
be co-located. The Somerville and Watertown stores will be both recreational and medical, or adult and medical. And the split here is that Boston is going to be adult, recreational, and Needham will remain store, which is unusual. I mean, it's a difficult market to service as a standalone, but that's the commitment, and that's.
But I think the nature of my question is just, even if you're making a commitment to not go medical, you would need to do a major change in your operation of the state regulation would have to, in order for you to even want to pursue.
Well, we would have. Well, we chose this, it was not because of the whatever regulations.
But you're right, we couldn't be back for a fourth license.
Right, so it's impressive, or it's important that you're stating that you have no intention to go recreational, but there's also the fact that it would be very challenging because of existing state regulations in their operations.
Well, we could have chose not to open the store, and this could have been co-located. We chose not to.
I guess
do
I'm
that
trying to
after
speak
that.
to the board's concern potentially that this might become recreational at
Right.
some point.
No.
So, Mr. Chair, Dr. Epstein and I were speaking earlier this week, and Attorney Smart in his letter referenced that essentially the fact, I'm paraphrasing, Needham's regulations are stricter than any other locations. 935 CMR 501.170 does allow for stricter local regulations. So just so the board is clear, you usually ask me to check with either town council, who's actually on the Zoom, as well as Cheryl Savara, who's the counsel for the Mass Association of Health Boards. So the board is allowed to be stricter, and it has been in its regulations stricter than other municipalities, and also in some instances stricter than the Cannabis Control Commission. That's a choice that the board has made, and I think SEER is having a policy argument about why that may or may not be necessary. But I just wanted to clarify that it is an option for the board to be stricter.
Yeah, I think I'm not sure that paraphrase, well, I think fair. The word stricter is not used. It's that there's a provision that was in the Department of Public Health regulations that got carried over to the Cannabis Control Regulation that allows local boards of health to create regulations so long as they do not conflict with the Cannabis Control. That's
So I do have one question. I'm just looking at the Frank's Friends initiative.
okay.
It sounds like a great program. So these folks have to provide documentation, both of financial hardship and the HIV/AIDS diagnosis, both in order to receive a discount. That discount's actually 50%.
That the Frank's Friends, I think,
Right.
is 50%. Yes,
Yeah.
that and all of this.
Right. No, but it's actually both, right? So they have a demonstrated financial hardship as well. Now I don't know if it's this.
Yeah, I don't think
one
it
that they have to
parallels
do.
with the Cannabis Control.
Yeah, because they do say that they require documentation of both of those elements. So there has to be low income status and HIV/AIDS diagnosis in order to qualify for that.
Just on, yeah, I don't know the particulars of that, but, there are different ways of, sort of benchmarking what's low income, what's not. And right now you have this verified financial hardship category, which talks about, 300% of federal poverty level. And, I printed out the numbers. I'm surprised at how low this number actually is. The federal poverty level for an individual, 2022, is $13,590. So 300% of that is about $40,000. There are plenty of people between 40,000 and 100 or 150 that could certainly use some help in buying their medicines.
So yeah, they actually put the requirements here. So it's either Mass Health, SSI benefit verification, or income statement. 300%.
I think
the levels you suggested.
my son is SSDI, and he doesn't make any money, but he would be actually he's got a disability diagnosis. He would be allowed he is still the SSDI program is not income limited.
Certainly of the groups you've presented, it would seem to me that, in terms of financial hardship, the seniors who may be on fixed income and veterans who may also be on fixed income would be groups that I would see, more, they would benefit along the lines of the financial hardship discount.
Yeah, I think it's probably a pretty fair generalization, but very large percentage of the patients that we're talking about don't make a lot of money, they couldn't afford to buy a house and stuff.
I mean, even if they,
Some
even
of
if they
them
didn't
here,
technically
they're
qualify under
already
the.
here, they bought a long time ago. And developed medical conditions.
Hi, this is Kathleen. These groups, do they get discounts at other medical marijuana facilities like in Newton and things?
Yes, they do.
And do they specify these, HIV, AIDS, cancer patients specifically, or?
In the other cities and towns, there's no limitation on discounting. It's not limited to particular identified populations. I looked into this a little bit, and there's some nearby facilities where they Garden Remedies in Newton. There's Ethos Cannabis in Watertown. There were Revolutionary Clinics in Cambridge and Boston. There's the Holistic Enterprises in Somerville. They all advertise discounts to patients routinely, and it's not limited to particular categories. That's the reality. That's the market. That's the market that Stewart is in. I'm sorry. Did I say?
They blanket discount. So it's not, okay, 20% or 30%, whatever it may be on certain products. We're not looking to blanket discount. We're looking to be actually very specific and follow what we've done.
But there may be a discount that in a particular timeline is specific to a veteran, specific to a senior, specific to one. So irrespective of whether they may be offering some blanket discount on products, if a person from a Frank's Friends comes in, then that HIV discount is going to be available if it's higher than a discount they make.
Just to be clear, then, these other places that do blanket discounts, so basically they're just lowering their prices, but they're using the discounting as a marketing tool, right?
They're carving margins. Yeah.
Well, do they do promotions like, Veterans Day, specials for veterans, that type of thing? And is that what we're looking at here, probably?
So we're looking at if you're
Yeah.
a veteran, this is your % off. If you have hardship, this is your % off, not blanket, not a special day, whatever it may be.
Yeah, I think there's a definite difference between what other medical marijuana retailers are doing versus what we're asking. So it's a set discount percentage as part of the program. Like if you are a veteran, it's X% every time you come. There will not be other promotions added on to that like other retailers are doing. So just to make that clear.
Okay, that's great. So I'm talking to board members. I'm sorry, I'm not in the room. I guess some of these groups seem a little bit arbitrary, right? Is HIV and cancer patients and how those are defined? I don't know how everyone's thinking of this. Are there other groups that aren't being included or maybe should? Are people going to complain? Something like that. So I don't know what folks are thinking on this.
Well, I think
I
that
can
was Steve.
speak to that. It's pretty much a standard in the medical marijuana industry across the board where there's veterans, there's seniors, there's special groups like Frank's Friends that, other retailers are launching just to help those classes of people that are in, that category. So,
right. I was asking the board members. Sorry. Thanks. I get that.
Okay, sorry.
I understand. Thank you.
Yeah, I think that is the concern, though, that, what about your dementia patient or whatever, there's going to be other patients that wonder, why them and not us? Because everyone suffers with their disease. I think veterans and seniors seems, there's just lots of discounts for seniors and veterans in our society. So I don't think that one's particularly controversial, but, picking two disease types versus, you probably have a whole array of people with a whole array of diseases coming in. I do worry about that piece. One other thing I think would be good to add in regardless is what was just said of the intent of having this be, consistent and not with sort of that added, on Veterans Day, you get this, having more language around kind of the intent around the discounting as well would be good. But I share the concern that, it just feels like we're just picking two groups that honestly have really strong advocacy. And there's lots of other groups that maybe don't have as strong advocacy, but could also benefit.
I think what we were trying to do was introduce the idea of this with two categories that we think are readily determined for membership. In other words, because of the clear diagnosis and the clear acute nature of that diagnosis, that it feels to us like these are two we're comfortable with, aren't going to involve diversion, aren't going to involve, buying for purposes that are.
Got to be careful with cancer, right?
Yeah.
Skin cancer was brought up, for instance, right? Which, unless you have melanoma, if you have a squamous cell carcinoma, basal cell carcinoma, these things are easily removed.
Sure.
Don't need, particular therapy. Are people going to abuse that? So there are some things like that that you have to talk about.
I appreciate
a little bit. But the chemotherapy thing, I think everybody recognizes is pretty well established.
Yeah.
There's no question.
Sleep and hunger.
Yeah.
I
The other thing that, and I don't know if it's up to this board to do this, but, you may want to take this up. You probably have a very good case to raise the hardship exemption to 400% of EPL. Because the American Rescue Plan Act provides subsidies under the ACA up to 400% of the EPL. I don't know if our board would say, something, we're willing to, move that hardship exemption up to that level. I don't know how we as a town would be able to, make that work, basically. But, you've got the federal government saying that, patients need health care and they need assistance up to 400%, not 300%. You probably have a good case at the State House if you want to take that to, for what that's worth. Yeah, but if we could operationalize that here somehow, I'd certainly be open to that.
I'll take some more thought. Yeah.
Mr. Chair, this is the second month that the board has considered the revised draft regulations. As you know, there were previous discussions before the hearing was open that took place in the winter and fall. The board can certainly take a vote tonight if it understands what it would like to support. If it would like to support the Public Health Division's proposed red line, if it would like to support any of the additional red lines offered by CIRA. The board can also choose to continue this discussion for another month, to either hold the hearing open or to close the hearing and then provide more time for the board to have public discussion.
I think at least for me, it's going to take a little bit more thought. I mean, I really appreciate a lot of the points that have been brought up tonight. And, I think, from my own point of view, we have always seen the medical dispensary need more as a pharmacy, but things are evolving, and I think the industry and the regular pharmaceutical industry are different. So I would like to have a little bit more time to think about it, and we can certainly leave the hearing open if there's other people that have things they want to say. But I'm not sure I'm ready to vote on it just yet. Yeah.
Is the question how to write it, meaning how to reduce it to writing other than how we've done it? I mean, we are old. It might not be written the way I'm saying, but we're not looking to do discount on top of discount. If it's more or if it's how do you distinguish cancer patient, HIV patient versus someone else?
I think that I agree. I mean, we're going to need more time to think about this. I mean, one of the big questions that that I've raised, and I think others have expressed, is, should we have a special class or any special classes at all? So I think that's going to be one issue for discussion, right? Then an issue for discussion is, is that discount available at all times? Are there separate, additional days or additional discounts? Or do we allow for it for that sort of thing? So I mean, I think those are, for instance, two issues. But I agree. You've given us a lot of food for thought. So I really appreciate the presentation. But I think we need to think about this pretty hard.
If those are the two open items, would you mind if we took a shot at it and tried to rewrite those, those paragraphs and come to you, and so we can differentiate, so it's not as broad as it might read. Because like I said, we're not looking to do a discount, or get this and it's a whatever day of the week. We're looking to be specific.
I mean, if you're saying, hey, let's work together to come up with some language that's going to work, which is what I think you're saying.
Yes.
Yeah.
That'd be a good idea.
Yes, we are saying that.
Can I
Work
just,
together.
sorry, can I,
Absolutely.
Go ahead.
Kathleen?
sorry, I just wanted to say that, I do think our board, we really need to consider that you go to the next town over there, all this is out the window, we're an island of regulation on the discount thing. I mean, so that's something to consider, right? So you can drive to the next town and get it. So considering not having this provision is something I think our board should keep on the table versus parsing these groups. It's something to think about as well. I will say, I don't know, the other major factor that we were concerned about was the labeling, seeing some of the products that are the packaging that is for sale. That we were interested. I don't know if that issue is still on the table, but that one is more important to me, as some of these definitely look like candy and marketed to children and things like that. So I think that won't go away, but or at least that's my view. I don't know how the rest of the board feels.
We're not asking for changes to other provisions that you've worked on, labeling being among.
We're governed by the CCC.
Yeah, there is, I will tell you that packaging and labeling is an issue at the state and even the regional level, because you have these companies that may own facilities in different states. And so you are asking, and so Maine may decide they want certain rules on packaging, and Rhode Island may want certain rules on packaging, et cetera. And what happens is, think of the alcohol industry. If everybody had to make a different can in every state, there's discussions around trying to coordinate that. We've looked at your situation versus the state and what we have to do in other stores, and we're prepared to stand pat with the state.
I mean, all packaging, and I can speak for us, I can't speak for everyone else in the state, but if they're following the rules and you get inspected, gets approved by the CCC before it's up. You're sending it in before you're going to production, before it's being printed. Where we're seeing, hence kind of why it's trying to do the discounts, is the stuff on the black market and is not labeled the appropriate way, which is out there. And then obviously the whole goal is not to have anyone buying from the black market or pushing people to the black market.
Okay. Thank you all for coming to.
Oh, thank you.
Speak with us.
You've doubled your time for us, and that's not.
I do think a lot of points you made have been very informative. And I think we'd like to make the best decision, obviously, that we can for this board and for Needham. And I think we'd like to have some further discussion and thought. And I guess for now, we'll close the hearing.
Board can close the hearing and then continue to debate, at this meeting and at a future meeting. The board can invite whoever wishes to come give additional testimony. The board has free broad discretion on this area. Okay. So we close the hearing for you and continue. Yes.
I don't think it would be out of place if you did submit your proposed version of the regulation, so we could see what you're.
I was listening to Lou speak, and I'm thinking, I don't know what I'm going to be tasked to write. You know, from my perspective, as somebody that's actually got to look drawing, I'm probably going to end up doing whatever drafting.
Oh, Lou's going to.
Lou's going to.
Who doesn't?
We're gonna give that. It would be helpful to us if you told us a little more where you're at. And then we can draft, because right now, we did give you what we would like. If you're telling us, well, we need to clarify the definition of seniors, or the definition of cancer patient, or something like that. We've got something that, sure, we can come up with perhaps a clearer definition that sort of articulates what you're interested in.
Maybe we could come up with a summary document.
Sure, if I could, Mr. Chair, we can take this discussion and make some revisions based on what the board's already talked about and identify some key points that the board would like additional information from Sierra on. If that's okay.
Yeah,
I think that's reasonable.
I think we've, at least I know I've heard some of your concerns, nuances of our proposal. We can at least go back and have a discussion among our team about what we've heard, how it fits into what's happening around the state and in other facilities, and maybe see if we can come up with something on that. But if you give us a summary of your view of this discussion, some thoughts, that then we'll have some opportunity to certainly, we're not going to discuss with 3-4 members of the board, but we'll have an opportunity to discuss with your team.
So we don't have a June board meeting set yet, but I think we would try to be in touch by early to mid-June. Early June, I guess, more likely, with the idea that the board meeting is probably in late June, and we would want to give the board something 5 to 7 days before their meeting to look at.
That sounds reasonable.
Thank you. All right.
Great.
Thank you.
Thank you very much.
Thank you. For the
Juan,
extra
thank you.
time.
Thank you.
Everything should be
Thank
okay.
you.
18, okay.
Do we have to have a motion to close?
Mr. Chair, if you might entertain from one of the board members a motion to close the hearing.
I'll move close.
Second.
Second, all in favor, say aye.
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 Hi, Kathleen. Yes.
So we're a little behind. I think it would make sense, especially in light of the discussion we just had, maybe to spend a few minutes on entheogenic plants and their impacts. Everybody's okay with that before we move on to the Rice Barn monthly reports.
So where do you want to go now?
To the entheogenic plants,
Oh,
I think just for a brief discussion.
It's okay, I guess.
Just, and this will probably take more discussion, but this is something that's proposed by a constituent. And there is some history. There are other towns that have adopted these resolutions. I'm just kind of cruising back to page 28. We certainly had a lot of discussion about mental health and substance abuse being recognized as a public health problem. And I think what this resolution endeavors to do is to decriminalize substance possession and recognize that substance abuse is really a public health problem more than it is a criminal problem. And that there are other things that go along with it, like arrests, that treating drug or substance abuse as a crime results in arrest, which results in a whole downstream problem for people in life, with criminal records, with rights in terms of student benefits or custody rights, things like that, which never go away. And, you know, law enforcement related to drugs and other substances, you know, you know, I think that's not something that they feel that they always want to be doing, and it also has resulted in a lot of discrimination. So I think this is something that which sort of addresses all of these things, and it's I think something that we should think about as a board, how we feel about this.
So I've read some of this over time, because this has been in our packet now, I think, for 3 or 4 months at this point. Okay.
It's the guest we never got to.
Correct,
Right.
that's right. I would not be ready to endorse this as is. This is a step too far for our town at this time. You know, that said, I mean, I think that the medicinal uses of psychedelics had been beginning to be well established back in the 60s and 70s before they were reclassified in Schedule 1. There's now additional research being done. They're actually showing some promise with PTSD. I mean, as some of the opponents, whereas have indicated. That said, complete decriminalization for things like distribution of these products, which actually require careful supervision and use by a professional, I think would be ill-advised at this time.
To be too good, but any document that as a reference cites Mike Tyson in the Weekend, I'm not sure if I think.
I agree. I also don't understand how these communities can sign something saying they're not going to enforce laws and things. I mean, it just seems, I don't know. I mean, I'm sure it's a treatment that works for many people, but yeah, I don't think we need to be cutting edge on this one either.
No, I think it's more in terms of just decriminalization. We're not saying that we, supporting people trying these things on their own or outside of studies or outside of medical care.
Yeah, but that's my point. How do we say something's not, I mean, it's right. I mean, you mean, how do we decriminalize it at a local level? I don't understand.
So, yeah,
It just becomes a low priority for policing.
so, but we don't have the power. I mean, the board does not have the power to do that and choose which laws the police can or can't enforce.
That's the problem. Yeah.
I thought that this guy came in asking you guys to sign a petition that would go to the State House, if I remember correctly, to support them in asking for decriminalization at the State House. That's where I think this document really came, when the kid came and spoke, maybe November.
Yeah, and I think that was asking.
October, yeah, I think that was his ask.
I think that was asking us to go too far.
Yeah.
That's my opinion. I think there's a lot of changes in the wind in terms of using these substances and the potential benefit of using these substances. But I'm not sure that research is there yet to justify us trying to, supporting decriminalization. That's my opinion.
So do we need a motion to, inform the proponent that, thank you for the information. We continue to have an interest in, in the medicinal uses of it, their plans, but we are not ready to sign this statement at this time.
I think that if you want to put that in a motion,
I would make that motion.
I'll second that.
Okay, and all those in favor? Kathleen?
Yes.
Ed?
Yes.
Steve?
Yes.
Teja?
Yes.
And Rob, yes. Okay. All right, moving on to the rice barn.
I would say, Mr. Chair, if the board's potentially open to it, town council was on briefly and then had to go back to a select board meeting.
Okay.
If the board wants his opinion, you could choose to do monthly reports first. But I do think we have most of the information, so we don't have to necessarily wait on town council if you don't want
Well, could we start hearing the information? And
Yeah, why don't we
see if
start?
Town council's ready to chime in. At that point.
So I think, and we have, I'll promote Ally and Diana, we have Tara. This isn't a public hearing, this is just a board discussion. It's follow-up since the board last met on April 25th and voted to uphold the summary suspension order. The board discussed it briefly on the 27th. Tara and her team were in touch. The concern we have is that it appears Mr. Intha was operating or allowing his restaurant to be operated, actually both using the Rice Bar name with online orders and using sort of the ghost kitchen concept that is a account or a vendor essentially page within food delivery apps like Grubhub or DoorDash that operated out of the 1037 Great Plain Ave location. We have social media reports, we have specific screenshots, and we have accounts from nearby restaurant owners that saw this. Based on that information and the failure of Mr. Intha to coordinate access to the site for the purposes of conducting repairs, the town sought an injunction in Superior Court. That process took a few days. There was a hearing. The injunction was granted, I believe, in the exact form the town requested, which specifically said you can't operate a food service business, you can't prepare food out of that location. If you're going to access the site, it has to be for the purpose of making repairs and making improvements so that you are rectifying code violations, and you have to coordinate that with the public health departments. The latter part has certainly not happened. The site has still been used and it hasn't been coordinated with the health departments. The select board held a hearing tonight on the status of the liquor license for Rice Bar. The select board ultimately voted to suspend the liquor license until 30 days after the food permit is reinstated, which right now is indefinite. And this is a brief paraphrase. Mr. Intha told the select board he's ready for a new health inspection, and we'll be asking the Board of Health to do that, which is news to us. Given the last time they were ready for an inspection and the number of violations we saw, we have concerns, but we would of course approach it objectively. Mr. Intha said that Grubhub is using his address to advertise for themselves and he is not currently selling. Don't know who is preparing food at that location, because there have been reports from Needham residents in the Facebook page that they've accessed some of those locations. He said before the court order that someone else could have been cooking when he wasn't there. But he said no one is cooking now and there's no food on site. Just as a comment, I don't think the select board was instilled with confidence with his answers and did vote fairly unanimously to take away the liquor license. The board does have some options. It can continue to afford Mr. Intha the opportunity to rectify the violations and eventually, when they are completely rectified, apply for reinstatement of this food service permit. The board could have a discussion, debate, and choose to permanently revoke the service operation permit because of repeated and sustained violations of the food code. The board could chart a middle course between those two. I think that's a decent summary. There was some additional information in your packet, which is very long, but the court proceedings and documentation were in your packet, as well as screenshots. A resident did email today with some additional vendor pages from door delivery apps that we had not found. We had found Thai, but not Thai. Two others.
We're absolutely certain that the only place that that food is being prepared is on that site and not some other site in some other town, and then
So it lists kind of
provided to DoorDash from that site or something like
certainly possible, not having been the person who received it. When you do an order with DoorDash, for example, I tried this out the other day. Bertucci's in West Roxbury, you can order a Guy Fieri burger, and it has the same address as the Bertucci's in West Roxbury. You can order, I don't know who Buddy V is, but Buddy V's cake slice, and you can order a cake slice. And it's at the Bertucci's in West Roxbury where it's prepared and distributed. So I tried that just to see, and it did come from the Bertucci's in West
that.
Roxbury. The cake was only okay, in case you're wondering.
Hey, it's a cake back from New Jersey. How do you not know? We got
Okay.
it.
Sorry. So, yeah, it sounds dramatic, but I mean, what do we have to do? Padlock the doors? You know? Okay, we're not gonna have a police stakeout there, but, you know, would the injunction allow us to, you know, basically say, you know, access to the site can only be with approval of the Department of Public Health?
Sure, so I
You know,
think,
I mean, that's hard to do. That's private property, you know, so I appreciate that.
Probably have to go back to court to be able to do that, because I don't think it says that in the
It
document.
doesn't, yeah.
Well, it says anybody who goes there needs to get approval,
Yes.
right? Which
We'll put
is
padlock
not quite the
door.
same.
oh, no, I left.
Yeah.
not the
I
same
will
as
say that
padlocking.
the town council could better advise us. If Mr. Inta is actively using the property, which it appears he is, Ally did go by the property today. The back door was ajar. She didn't go in, but she did notice that there were paperwork and bills and some pads of paper on the table, as if someone had been doing paperwork there. Mr. Inta appears not to be following the court injunction, and that would be taken by a court to be a more serious violation than closing the door. That might be a contempt of court finding, which would be very unfortunate if that were the case. I think no one on our end is looking for Mr. Inta to be found in contempt of court, but we want him to respect the injunction and to have his total focus be on remedying any of his violations so that he could eventually get his permit back. Last time when he had more than a week to make repairs, things that included cluttered cardboard boxes in the basement, which seems like one of the easiest things to fix, were still there.
Yeah, and I can add too that the one violation that was blatant was the 3-bay sink in the basement that needed a permit, which was written up back in March. And he keeps saying that he's ready for inspection. Lynn, as of this morning from building, told me he has still not pulled a valid permit for that sink. So he has had multiple weeks to work with a licensed plumber to bring that sink into compliance, or at least to verify compliance, and that still has not been remedied. So I wouldn't even go back in there until that sink was at least permitted.
Most importantly, I'm just, the fact that he or somebody in that restaurant was doing Grubhub and basically not following what this board designated to me is like, I don't know, I feel like that's kind of do not pass go. I mean, when we very clearly said you have to shut down and do these things, and then they basically tried to get around it, like, I'm not sure that's a forgivable offense.
I don't either.
I was just gonna say, I agree, and he doesn't even know who's in the place is really a troubling development, right? If there are workers that are going in and filling order, like, that really is a problematic management
that's-
problem.
Straw man, I'm gonna throw out a proposal here, okay? It's in 2 phases, okay? So phase 1, you have to actually document that they're using the place inappropriately, all right? That's yet to be done, all right? And if he is, we follow through with court. Sorry, I mean, that's the commitment we made, because otherwise we have lots of others who are going to be doing this as well. We learned our lesson last time. Secondly, I think we set a timeline, right? He's got 30 days to come into compliance. If he's not in compliance, we permanently revoke his license.
I agree.
The first piece, I mean, we do have documentation that they,
We know that the DoorDash or Grubhub was taking, food from there.
We have
and
lots of
going out,
pictures
and
from
he
all
was
the
using it.
emails
If
from
you got
residents.
enough, then you bring
That's
that to court. We're not doing this because we don't like the guy. We're doing this because he's selling food that could be harmful to our
Exactly.
citizens. So we need to protect the public.
I think I agree with Steve on both of those points. I think if we have the documentation, we should take it to the court and let the court proceed. It's the court's decision at that point. And I think that we should definitely give him a
I'm
drop dead
definite. I mean, I'm.
deadline.
30 days is an option.
Whether
But do we
it's
even give him
20
30
days,
days?
30 days.
I mean, why are we even giving him 30 days when he's literally like not followed what we asked very clearly with documentation? And I'm usually not a hardliner, but I'm not happy about this.
I think
Because-
the last
Doesn't
report
seem
from
like-
Monica as well, she had it documented and he had admitted, and she wrote that in the report, that he admitted to her that he was continuing to sell after that initial closure was issued. So it's within even our own reports.
I think we should give him one chance, whether it's 3 weeks or 4 weeks, whatever it is, and then take his permit.
So I do think there's a question to be asked about if you defy, regulatory authority, if you have, you appealed what you thought was an unjust closure. The board found you appealed it despite hundreds of pages and a lot of photo evidence. You appealed that, the board held a hearing, listened to you, and ultimately concluded that the suspension was imposed in order. And you still define that, even though it was very clear from the April 25th hearing what the responsibilities and what the requirements were. I think there should be some consideration of you willfully defied this and that should warrant a penalty. In speaking to town council previously, and I wanted to make sure I clarified with him, so I'm not sure we have it. He indicated that he thought permanent revocation legally rested better on repeated non-compliance, repeated violations, rather than sort of bucking legal authority. That we're not necessarily taking it away from him because he, ignored us and we're mad about that, but because every time he prepares food, it's a roll of the dice on whether people are going to get sick. I think if we were going to structure our arguments, if there was a case to be made for permanent revocation, it would be there have been many chances and there have been repeated serious violations. And because of that, the Board of Health has no confidence in your ability to safely run a restaurant, and we do not think we're not going to give you any type of food permit permanently.
That's why I want to give
think we
him
already
30
have all
days
that.
in order to make those necessary repairs, restorations, whatever he needs to do, to give him adequate time, and then he has an inspection. If he's not up to snuff, that's enough. He has multiple additional violations, still can't do this. Despite that, he has had that's basically the last chance.
Well, and we gave him that list a month ago.
Yeah.
So he's already had 30 days.
Understood.
Right. But this
So-
time the penalty is permanent closure,
Permanent, right.
as opposed to, okay, we'll give you another
Yeah.
chance.
Let the court deal with, the going against our suspension, that's a court issue. If we've got the evidence, we present it to court. That he's gonna have enough penalties on his head from that. We should. But from the food safety standpoint and revoking the license because of food safety, he's got to, we're giving him a last chance here to do it. That's what we said we were going to do. We said you need to shut down so you can repair. All right, we're trying to force him to shut down so he can repair. This is kind of his chance to do it. If he can't make it, he can't make it. That's that. Be sad, but then I don't think anybody could ever fault us for not bending over backwards to let this guy have a chance to operate a restaurant here.
I think we've given him more than enough.
No, we already have.
I think we have too.
That's for debate. I understand. Some people may say we've already given him more than that. We should just shut it down now.
Well, the thing I am concerned about is, this board needs to have authority. And so if, others see, this guy like totally, blew off what they were saying, and then why can't we also do that? So I do
Exactly.
worry about the implications of, not that I want the argument to be solely based. It's not because I'm mad at him, because it's also, to your point, that, he's running this out of this kitchen that could be very harmful, with the scrub hub stuff. So, but I think, it sets a precedent for, anytime in the future when we are saying you have to stop, people could say, wow, look what happened before, like nothing, there were really no consequences.
Exactly. I agree with you exactly. This is setting a bad precedent. We let this continue much longer.
So again, those were notes that someone sent me who was watching the select board meeting. But Mr. Inta did indicate he was ready for reinspection. do we contact him and say we're willing to provide one, or do we say the board is giving you 30 days and tell us when you're ready and then we'll come in?
Yeah, and if he says we're ready now, I mean, but I would make it clear, you get an inspection, right? If you say you're ready now, we are happy to provide that inspection now, but if you don't pass that inspection, that's it, you're done. If you need more time, so think carefully, if you need more time, we're willing to give you some more time to, to make repairs. But can't be running the business while you're making repairs.
I mean, what happens if there's another documented Grubhub?
That
I
would
think
be-
we start the
Well,
court
that-
proceeding now anyway. I think we take them to court right now, tomorrow morning.
We have clear evidence of accessing the property without coordinating with us. We have, and I don't know if they're willing to say so publicly, but a nearby business owner that saw food being handed out the back door earlier this week. We have social media posts, which I don't think hold up in court. So we can work to get more documentation.
Now, the only thing that's going to hold up is what we have. I mean, you can ask the neighborhood business owner, but even that, I mean, there may be competitive issues there that, I just don't know that that's such a great idea. But if we don't have to go that route.
Yeah. We'll proceed on that track.
Okay. Okay, we're gonna give a timeline then? 30 days or?
What do people want? I just threw that as a number because I wanted to get the conversation
I
going.
mean, he said in the
said
select
he's
board that
ready
he's
now.
ready
If
now.
you said, yeah, if you say, if he's ready now,
2 weeks.
fine. I would say 2 weeks.
2 weeks max.
Yeah.
Okay.
We'll engage through town council. So our lawyer will talk to his lawyer and say, you indicated at this meeting you're ready. The Board of Health says you can have 2 additional weeks, but it's only going to do 1 more reinspection. So decide whether you want it now or in 2 weeks. And we're happy to do it. However, if possible, when that does happen, it would be great to have maybe Dave Roach or one of the building inspectors go. Because one of the big issues is the unpermitted sink in the basements. And that's one of the simplest ones to fix. Just takes hiring someone and getting it approved.
Right. Don't entrap them. I mean, if you know that that's a problem, say, look, if you really want inspection now, remember that sink?
Yeah.
Are you really ready? If you're not, just bear in mind, if you have, we're talking about permanent revocation of your license. We're talking about you losing your job here and all your employees. So please take this seriously. You get one chance here.
Yeah.
Needs to know what's at stake. This isn't just, you're gonna have another chance to, to reopen.
So that this is not just a wrap on the knuckle of the roller.
Yeah, and what I'm concerned about is all the staffing problems that he had. I mean, I'm certain he's lost all his staff by now, a month later. And so he may be starting from square one again, but.
Okay. Next is reports. And I think,
So you can blister through these.
yes, substance use prevention, Karen.
Karen, you're on mute.
Good evening. In the interest of time, I will be sensitive to other people following me with their reports, so I'll keep mine brief. Just adjust my lighting. So the month of April in substance use prevention was primarily busy with a number of SPAN activities, and that included our action teams working on initiatives that had been in production for a while. For example, our community action team finished some social host liability messaging for parents and students in preparation for the upcoming celebratory season of prom and graduation season. I'm sure most of you are familiar with social host liability, but it pertains to underage drinking and youth drug use on the premises, on people's premises, which can make them liable if youth are furnished with alcohol or other drugs, primarily alcohol. Our youth action team launched a initiative called Talk About It, which provides peers at Needham High School with the opportunity to submit an electronic form to the guidance department if there was a particular concern that they wanted to reach out to a trusted adult about, either for themselves or a peer. That's a program that our SALSA students identified on their own, and the youth action team helps support them to bring that to fruition. And then finally, our parent action team has been working on creating new content every other week for a campaign for parents on conversation starters with their children, especially now as we see so much between the intersection of substance use and mental health. Encouraging parents to have critical conversations with their children is so important. And this campaign is aimed at trying to build that trust and open lines of communication between parent and child. So we'll be continuing, we'll see that campaign continuing throughout the spring and hopefully again in the fall when school starts back up. I did last month talk about the alcohol compliance checks that were coordinated with the Needham Police Department, so I won't reiterate too much of that. But as I do understand, the select board had a chairs meeting on Friday, May 20th with the 5 businesses that had a sales to minor violation during the April 6th alcohol compliance checks. So we will stay tuned to find out what will come of some of those violations. There was a business who had a repeat violation, and I believe they are going to be called to a public hearing sometime in June. That date has not been set yet with the select board at last check with the town manager's office. And then finally, we had our spring annual take back day, drug take back day that we partnered with the police department on. We were delighted to have Representative Denise Garlick stop by to support our efforts, and we collected 84 pounds of expired and unused medications from the community, which combined with the previous 6 months of medications disposed of at the police department, we had a total of 346 pounds that were turned into the incinerator operation that day. So other than that, I would say that's really the highlights of the month, if anybody has any questions.
Questions for Karen? Okay, moving on. Thank you, Karen. Public health nursing.
So Mary is at a conference, so I will touch base for her. Key things are really uptick in COVID. So she's working with some of the long-term care facilities and other facilities in managing clusters. Hannah passed her certified health education specialist exam. So she is our first CHES in Needham Public Health to be certified, which is awesome. And then they continue COVID clinics, COVID vaccination booster clinics at times. It just wanes back and forth when people want it, when they don't. But she usually holds one about every Friday. That's it. If you have any questions about the diseases, I don't actually know any of them. So we have to save those for next month when Mary's back.
And just assuming that the Campylobacter is not from rice farm.
I would hope not. I mean, I would assume Tara would know about that, but I would hope not, yeah.
Yeah, and then this is recommend that this is salmonellosis and question. Yeah. Okay.
Yeah, I don't think so.
What about the 3 latent TBs?
So she's still working through all of those with the state in that process, as far as we don't get notification of the latent TBs, and all of a sudden they just pop up and they've been there for like 2 months, and it's really weird. So she's working through the process of all that, and hopefully we'll have more information. She's actually at a TB conference right now, so hopefully have more information on that process, how it works.
Do we get notified of all dog bites? Some
So we're
past-
supposed to.
Yeah, in the past,
Uh,
there was one, at least that was discussed by the select board, which I don't think we'd heard about.
Yeah,
So
so
I just
we,
wondered what the mechanism was and.
well, so it's depends. If it's a dog to dog, it's more Tara and her team that get the notifications. If it's dog to human, then it's public health nursing. But we don't actually get them anymore because the animal control officer is in the police. So how the process works is we're supposed to get notification from DPH and the animal control officer is supposed to call us. The current animal control officer is on some kind of long-term leave at the current moment in time, so it's a difficult time getting communication back and forth about who is monitoring the dog bites and who is not. So Mary was gonna work on that process as well to see if there's a different line of communication she can open up to get that. But yeah, sometimes we just get them from DPH, sometimes they take 2 months to get to us. Sometimes
Is that a
come back,
required
sometimes come
report
back.
from the emergency department?
Yes, if someone's injured in dog bite, it's required.
It's required to the state health department, so.
So report it to the town. That happened. Typically to animal control or police. And then it gets.
Yeah, and we usually see an uptick around this time, springtime through the summertime is when we get most start dog bites.
Okay,
All right, so I'm
thank
gonna,
you, Tiffany.
Pop on.
Epidemiology.
yeah, how about for Julie too? She's having technical difficulties at the current moment. She said she didn't really have much else to report besides the COVID. She's just working on a lot of data management for us, Metro West Adolescent Survey. She's working on ArcGIS to get us some COVID and all things, to be honest, disease mapping for the town of Needham. And she gave a presentation to public health nurses about vector-borne diseases.
And the adolescent health survey, the data is expected.
So
At
they're,
the end of this month.
yeah, I think they're actually doing a thing for people to listen to on the 10th of June, and the data should come out shortly after that, the actual report.
Okay, emergency management.
Good evening, everyone. So the big thing for April was that on April 18th, President Biden finally approved the disaster declaration for the January 29th blizzard. So I've been working with the finance department and the DPW for that. So far, we're still in our request for public assistance with FEMA. But it should be a fairly straightforward, if slow process to get the town reimbursed for 75% of our snow removal costs for the January blizzard. Another big thing in April was that MEMA, excuse me, was able to complete their final drone aerial pictures of the Newman School for their commodity points of distribution plan, which they're going to develop for the town. And so this is a plan that would be used if, say, our water system went down and bottled water needed to be handed out to residents. We'd be able to set up a drive-through distribution point primarily at Newman. But if school was still in session in a very unlikely scenario at the parking lot at DeFazio, and these locations were selected in conjunction with the Needham Police because they already had traffic plans already developed for these sites. So that plan should be published very shortly. Any questions?
I have a question. Just given the events of today, I know we've done a lot of emergency planning about active shooter in the schools and all of that. And I was just curious if kind of where that stands at this point, how often that gets done or.
So active shooter has unfortunately not been done in the last few years because of COVID, but the current plan is to do it in the fall. I believe the police have it on their schedule for, I believe, October.
An active shooter in a school or town building is one of the scenarios that we think will be at the top of the HEA. I think Michael will probably talk a little bit more about that next month. But active shooter or active threat scenarios are high in Needham's HEA process. hazard vulnerability analysis assessments. Sorry.
Texas. Yeah. Yeah. All right, Michael, thank you.
Thank you.
And traveling meals, Rebecca.
Hi. Quick update. So we delivered 858 meals in the month of April to 52 consumers, 41 of those being Springwell consumers and 11 of them being private pay consumers. We had 7 new clients, 4 private, 3 Springwell. We did have one 911 call. She just happened to be at an eye doctor appointment and neglected to tell me and her son. Not a big deal, thankfully. I did work with Tiffany to implement distributing COVID test kits. So put flyers in the bags, asking them to call me if they would like to receive COVID test kits. That's been somewhat of a success. And the Friends of the Needham Board of Health and Traveling Meals, they purchased Roach Brothers gift cards for our clients, $25 gift cards. And we distributed them to the clients as kind of a thank you gift and a recognition of them. Just because we know, times are hard and they just wanted to do something nice for them. And based on last year's numbers, the meal count is up 7% over last year. So, any questions?
Answered my one question.
No questions. Thank you.
Okay, thank you.
And accreditation.
Good evening. What I'm going to do is, rather than go over the specifics that are in the report that you folks have read, I'm going to tell you about some newer progress, which is on the senior assessment. The senior assessment will be part of the community health assessment. We have been working with an advisory committee, and the survey is almost done, just about ready. We hope to administer it in June. We are beginning planning for focus groups and for key informant interviews. The community health assessment will also include some newer material. The town is currently doing a survey on kind of quality of life issues, and the questions are terrific. And we will use that as part of our community health assessment, along with the BID Needham Community Health Needs Assessment, which is also really terrific. So I think we're in good shape. Happy to answer any questions about the report or anything else.
Lynn?
I think you're going to make some good progress, though.
Yeah. It's great to get updates every month. Thank you, Lynn. And finally, environmental health.
Sure, I'll start off. So just a couple updates. So we want to bring Kristen Petnor, the new recording secretary. Well, yeah, I'd like to introduce her. She's our new recording secretary that started yesterday. This is Kristen. She can maybe give a little bit of update about herself, but she's started this week. We're happy to have her. You want to give a brief update on your background for us?
Sure. So I actually live in Amherst, New Hampshire, and I take the minutes currently for 9 other towns in New Hampshire and Massachusetts and Connecticut. So it's sort of a business that I'm starting to make in for myself. I have 2 children and 2 cats, and just very interested in learning more about municipalities. Everyone does it so differently. So it's a great learning experience from town to town. So thank you for having me.
Welcome aboard.
Welcome, yeah.
Thank you.
And another update, we did hire a couple interns. I'll go over one of the interns, and Ally, if you want to cover the next one, but we were offered to host a Mass Department of Public Health intern for the summer. So he started this week as well, Monday. So Ecom Lou, so he'll be helping us out with some updates for a little bit of different topics that we have going on. So we have the farmers market inspections, obviously, so he'll be working with us on those. Some other offshoot projects that he'll be helping us with FDA standard projects. And so we're going to be basically just keeping him busy for 200 hours. He'll be getting that, working through the end of August. So we're grateful to have him work with us. We talked about the rice barn. We did, one more update I'll give is about the Viewpoint Cloud online permitting endeavor. So we're working with IT, as you know, getting all our permits online. Our last one that we finally got up there is our septic construction permit. So Terry from IT has been helping us with that, and that went live on May 11th. So that will be great to finally have everything online. And so it's a great resource. So unless you have any questions for me, I can let Ally go ahead, give it an update.
I like to write up here, encouraging on the food complaint you had about the hungry coyote.
Oh, yeah.
Your description of what you found at the hungry coyote. It sounds like we made our point.
Oh, yeah, definitely.
So our second intern, her name's Deandra Linton, and we accrued her through the National Environmental Public Health Internship Program. She is completely virtual. She's actually located in Florida, so that's going to be a little bit of a challenge, but she's going to help mostly with our materials for Nutritionally Needham, gearing up for that in the fall. And then we're also going to have her work on our pesticide initiatives, hopefully create some social media posts that we can show to you as well. We emailed all the people who have permits for chickens. Highly pathogenic avian influenza was detected in Massachusetts. So we worked closely with Tiffany and with Julie on just an email to educate them about that, make sure that they're aware. There was one food complaint at Hungry Coyote. I went to inspect. Everything was compliant. All the temperatures were good. Everything was neat, organized, and sanitary. So it's hard to say if the illness was from Hungry Coyote. And then finally, at the end, we have the priority violations. Fuji Steakhouse, Little Spoon, 2 inspections from the Rice Barn and Fresco were the 4 restaurants that had priority violations. I would like to note that we followed up with Little Spoon and Fuji Steakhouse today, actually, with a re-inspection. And as I'm transitioning into this new role, and we have a lot of new inspectors as well, we're definitely going to be working on Standard 6, which will really formalize our inspection process. When do we go back for re-inspection? When do we bring these establishments before the Board of Health? Any questions?
Questions for Ally? All right, great. Thank you, Ally. All right, that brings us to the end of the monthly reports. So we have two more issues: board reorganization and June's meeting. June meeting, a doodle poll, or
Sure.
you want to do it now?
If it's possible, maybe Diana could give a very brief, Diana and Carol could give a very brief update.
Oh, I'm sorry.
No worries. So brief update, Roland officially got his ServSafe certification and his certified pool operator certification. Still working on trainings. The boards all voted for a name for the group for the shared services. So we are going to be called the Charles River Public Health District moving forward. I'm working with a graphic designer now to create a logo, and I'll get you guys will get some emails from me about that. But the grant is trucking forward, just focusing on training and making the connections with the other 2 towns. So if anyone has any questions, let me know.
Go ahead, Carol.
Hi, nice to see everyone. And I thank Tim and Tiffany and Diana because I always have my Medfield Board of Health at on, and we appreciate shared services. Yes, I always have a few things to say. As usual, my report was late. I have a wonderful piece of news. Elisa, who's our DPH, who's our public, BU School of Public Health, part-time staff person, graduated on Saturday. So Elisa is here with us, and she's another person that we've benefited from the BU School of Public Health. Segue into, we were notified by the Department of Public Health that Needham will receive for FY23 a new contract. Our grant currently for the 4 towns is $125,000 a year. It will be for FY23 $250,000 a year. And I've been working and appreciate Tim and Tiffany because we're looking at how we're going to spend those funds to actually fulfill the mission of the grant, which is to build capacity in Walpole and Westwood, who are communities that don't have public health staff. So 2 of those things will be to get those towns Metro West adolescent health surveys, which we have since 2006 gotten free of charge, and that's about $30,000. And then our hope is to get a full-time employee in paid fringe out of that allocation to be able to use the funds in a thoughtful way to build capacity. So I appreciate Tim and Tiffany working with me because it came as a surprise. It's actually, the state is using ARPA funds, substance abuse block grant, obviously from the feds, and ARPA funds, and expect also to give Needham that additional $125,000 in 2024. So that's great news, but we want to be thoughtful about spending it. And as far as our grant and our strategic plan across the 4 towns, Lisa and I were in 4 high schools and did over 160 students with youth focus groups. And we're working to collect quantitative data, EMS data from the 4 towns, Riverside, emergency services data, hospital admission data, and put that all together to continue the strategic plan. But I'll stop talking and thank you. And congratulations to Elisa, and I believe she's still on.
Any questions for Carol or for Diana? All right, thank you both.
Thank you.
All right. So I think that does bring us to the last 2 things. So for our June meeting, we need to do it now. We can do a doodle poll.
Sure, I did send out a doodle poll this afternoon.
Okay, I didn't see it. So
I was shooting for Steve, I think had AMA commitment.
Yeah,
Ed had it, so you were out till the 15th. Ed, you were out till
I'm out till the
18th. So
I'm
really
out to
we're
the
looking-
18th also.
You're out to the 18th also. Okay, so we're really looking at the week of
Last
the
2
20.
Last
first
2
of the
weeks.
20, yeah.
Yeah, those next 2 weeks.
Yeah.
And I put in my time. There's one day that I can't be there.
Okay.
That's great.
Okay, 1 week of days, second 1 week of evenings.
One thing I would like the board to consider is whether it's possible to try to get back to a set time. long time ago, the board used to meet Friday at 7 a.m., the second Friday of the month. Sometimes with people's schedules, it's easier to schedule out in 2 or 3 months chunks. Other times it's easier to sort of try for that consistent day a month and then have to change it a couple times a year. I do think it makes it a little challenging to sort of have it be, a Thursday night one month and a Tuesday night the next month and a Thursday morning the following month. Especially if any resident is interested in attending, it's harder for them, I think, if we move around.
Actually, we found it was easier for them. One of the criticisms that this board has had over the years is that we would have our meetings early in the morning, and residents who need to get to work could attend. So having an occasional meeting in the evening is actually beneficial, allows them participation.
Yes, I agree. I think
we'd like to have it on a more regular
Yeah.
schedule, if I understand.
Yep. I don't think we need to figure that out tonight, but it's just something maybe the board could think about, and we could schedule a June meeting potentially. And then the last question is the reorganization.
Okay.
In terms of reorg, I think the only one up for re-election next year is Ed. Is that correct?
No, I'm also,
Should be another one, right?
I'm also up next year.
So
No,
it's-
No,
you up for-
Rob, you and I just got reelected.
sorry, we're only a
because I
year into our
realized
3 years.
you're-
Last time I was a 2-year
you're-
term, that's why I forgot
So
it, an
next
extra
year's-
year.
Next year.
Oh, that's right.
Only one getting.
You're the only one up,
For
Ed,
reelection
so
next
therefore
year.
I will nominate you as the new chair of the board, if you would accept that.
Sure. As long as I don't screw up the date again.
Historically, the board has only had a chair and a vice chair. Given that we've talked about, and we still have to present the board with a draft standard operating procedure, but given that we've talked about having restaurants that have significant priority violations in for one of an administrative hearing before one of either the full board or 2 members of the board, it might be valuable to appoint a clerk so that the chair or vice chair wasn't available, the clerk could sort of step into that administrative hearing role. So historically, the board has not had a clerk, but that might be something to consider.
But we've only had 3 members in the past, so you didn't need it. But
Yeah.
Need to be someone with an official title, or I'm just thinking from a flexibility standpoint, if it can be, 2 people aren't available, then it gives you more options if there's.
It certainly could be anyone, yes.
3 clerks.
Exactly.
Okay, is that, well, even before we get to clerk, should we have a nomination for a vice chair? We have a chair has accepted.
Well, assuming, I mean, we have to have a vote on that, but I nominated the chair. So
So why don't we vote on the nomination for chair? Red Cosgrove, so I'll second the nomination. And all those in favor, I guess by roll call, Kathleen?
Yes.
yes.
Tejal?
Yes.
Rob is yes.
Ed, yes, I guess.
Our condolences.
So you're gonna abstain there for a second. Okay,
Vice chair,
vice chair.
I'll nominate Tejal. If you'd accept.
It's, well, all I can say is I'm very much a newbie, so
I
if
know.
you want a newbie to be a vice chair, then that's fine.
You seem to be a quick learner. Sure. I will second that motion. So Tejal is vice chair, and by voice vote, again, Kathleen,
Yes.
Ed,
Yes.
Rob is yes, Steve,
Yes.
and Tejal.
Yes.
Okay,
Congratulations.
all right. And should we do a clerk? I don't think it's an unreasonable thing to do. Hopefully the clerk won't be called upon all that often.
Yeah.
I think it does also help in the instance, Christina was the vice chair, it would be assumed that the vice chair would move up. But we had sort of a designated clerk, and there was an instance where the vice chair chose not to run for re-election, there might be sort of an expectation that then the clerk might move. The board is under no obligation to follow that sort of process. It can.
As you see, we're not following it tonight.
I'd nominate Kathleen Brown.
Sure. I will agree to that if others want that. That's fine. I have more time than the rest of you folks.
I will second that nomination. And I guess we'll vote.
Okay.
We'll start with Steve.
Yes.
Tejal?
Yes.
Rob is yes.
And yes.
Kathleen?
Yes. Thanks. Tell me what that means, actually, at some point. So,
Yeah.
One item before we adjourn, just if you could keep us informed about monkeypox. I mean, this should be a non-threat. It's kind of remarkable that we're hearing about this popping up all over the country. So we should just keep it in mind. That's all.
Yes.
All right.
They, I mean, I could give a brief update. They reported today at DPH call that there were 200 exposed to MGH. So they have acquired vaccine and given some to MGH and certain providers to provide to those people. We are monitoring one specific case right now, one exposed resident.
All right, motion to adjourn.
So moved.
I think technically you're not allowed to ask a motion to adjourn now.
that's right. It's Ed.
So moved to it. I will ask for motion to adjourn.
All right, so moved. Mr. Chair.
Second on that?
Second.
All right, Kathleen?
Yes.
Okay, Steve?
Yes.
Tejal?
Yes.
Rob?
Yes.
And yes. So be it.
Thank you, everyone.
I realized it was effective.